Our topic today is about casualty management, and we are going to learn on how to manage a casualty who is unconscious but breathing. And we have two steps to follow, and these steps are primary survey and secondary survey. So we start with primary survey. What is primary survey? Primary survey is a quick way to find out how to treat any life-threatening conditions a casualty may have in order of priority in a certain sequence of find and treat basis. When performing primary assessment, depending on your findings, you're not supposed to move to secondary assessment before stabilizing life-threatening condition under primary survey. We can use DRABC or Dr. ABC to do this, where D stands for danger, R stands for response, A stands for airway, B stands for breathing, and C stands for circulation. We always start with danger. Do a scene survey and check if there is any danger to you first as a first aider, the bystanders around, and the casualty. Remove any danger before and ensure safety before you assess the casualty. And if you can't remove the danger, call for necessary assistance. The second step is to check for response. Check level of consciousness of the casualty by asking a direct question like, "Hello, can you hear me?" Give a command like, "Open your eyes or wiggle your toes." Shake the casualty's shoulder gently and do not shake the head. The level of response is in order to accurately measure the casualty's level of consciousness. And we use a scale of consciousness called AVPU scale or COD, where A stands for alert, V stands for voice, P stands for pain, and U stands for unresponsiveness. So when you check for alert, is the patient alert? Can the casualty open the eyes or can he or she answer the questions asked? When checking for voice, is the casualty responding to your voice? Can he or she obey the command and answer the question you ask? For under P, the casualty is responding to pain or not? Can he or she move if pinched? And U stands for unresponsiveness. Is the casualty responding? If there is a response, then establish what happened from the casualty and proceed with your assessment. Treat any conditions found and monitor vital signs like level of response, breathing, and circulation. And monitor the casualty until help arrives or he recovers. And remember to record vital signs every 10 minutes. But if there is no response, shout for help or call for help or send for help. Do not move the casualty unless it is absolutely necessary, like when maybe there is an immediate danger. If this is not possible, turn the casualty onto their back and open the airway after a quick assessment. The third step is to open airway. Open airway by held tilt maneuver. Place one hand on the casualty's forehead and gently tilt the head back. Then lift the chin using two fingers placed on its bony part, the chin. This will move the casualty's tongue away from the back of the throat and thus clear the airway. And we use head tilt maneuver to casualty who we do not suspect they have spinal injury. But if you suspect spinal injury, open airway using jaw thrust maneuver, which we will learn later when we'll be dealing with spinal injuries. The fourth step is breathing. Under breathing, you need to look, listen, and feel for 10 seconds. Look to see if the chest is rising and falling. Listen for breath sounds and feel the breaths against your cheek. It is important as well to note the rate and depth when he or she is breathing. If the casualty is breathing but unconscious, place in the recovery position, and I will explain recovery position in a while. And if the casualty is not breathing, proceed with CPR, which CPR stands for. C stands for cardio, P for pulmonary, and R for resuscitation. And I will explain later in full. Watch out for agno breathing. And agno breathing is a sudden, irregular gaps of breathing, and it is common in the first few minutes of a sudden cardiac arrest. And if present, commence CPR immediately. The fifth step under primary survey is to check for circulation. Bleeding interferes with blood circulation in the body, and it can be life-threatening, and it might lead to shock as well. So in case you see bleeding, control it so to minimize the risk of shock. Assessing circulation is no longer important when doing a primary survey, because if a casualty is breathing, then pulse is present. If there is no breathing, then commence CPR immediately. No need to check for pulse. Nevertheless, pulse may give crucial leads for diagnosis and is therefore an important part of the secondary survey. In all cases that you must touch the casualty, kindly remember to put on gloves. Now we move on to secondary survey, where we are going to do more detailed assessment. And here we are checking for things like bleeding, fractures, burns, sweating, wounds, foreign object, loss of normal movement, and many more evidence of any condition if it is there. And while doing all this assessment, be very careful not to move the casualty unnecessarily, especially if you suspect neck injury or spinal injury. Under secondary survey, we do assessment called top-to-toe or head-to-toe assessment to check for more details. Top-to-toe. And now we do top-to-toe survey and follow history and external clues. Check all the areas quickly but carefully. Begin from the head and proceed systematically to the feet. Check the scalp to feel for bleeding, swelling, depression, which can indicate a fracture and deformity. Always watch the casualty's face for grimace due to pain while touching. Loosen any constriction during the survey. If you find any condition like bleeding, attend it fast and proceed with the survey. Recheck breathing for more details like is it fast or shallow, is it fast or slow, and is it noisy or quiet. Then check pulse and establish if rate is fast or slow, if rhythm is regular or irregular, and if strength is weak or bounding. Check the eyes and compare the pupils, and if they are not of the same size, it may indicate head injury. Check the nose and ears, and note that any bleeding through the nose or ears may contain cerebrospinal fluid following a skull fracture, or as well clear fluid or watery blood coming from the ear may be a sign of a serious head injury. And for the nose, if see soot around the nostril, it might indicate serious airway burns. Check the mouth if anything is obstructing airway, and if dentures are fit firmly, then leave them there. Look for burns and mouth wound, and also check for irregularity in the line of the teeth. Check the neck for irregularity, swelling, tenderness, bruises, deformity. Also check for medical warning necklaces, and check if there is any hole or stoma which used to some patient or which are used by some patient. Check the skin color if it is pale, flushed or gray blue, clammy. Check if it's hot or cold, dry or damp. A pale, cold, sweaty skin suggests shock, and flushed face suggests fever or heat stroke, and bloating indicates lack of oxygen. Examine the chest for tenderness, deformity, and irregularity as well. You can ask the casualty to take a deep breath if they are conscious and see whether the chest will expand evenly, equally, and easily on both sides while listening for unusual sound. Ask if it is painful when breathing. I repeat, you do this if the casualty is conscious. They can talk back or they can hear you talking and they can respond. Check the collarbones, shoulders, and rib cage for any swelling, tenderness, or deformity. Examine the backbone, the spine for swelling and tenderness by passing your hand through the natural body hollows. Examine the abdomen by gently feeling it for tenderness and rigidity, which could be a sign of internal bleeding, and also check for skin discoloration and bruising. Check each arm individually and then compare them. Check the fingers for any discoloration or pallor. Examine the pelvis for sign of fracture and check for any bleeding from orifices and any evidence of incontinence, which can be a sign or can suggest spinal or blood injury, or even can suggest pelvic fracture. Check the casualty's pocket for any clues like medical cards or any medication. Examine the lower limbs. Look, feel, check for bleeding, swelling, deformity, and tenderness individually and compare them. Remove the footwear and examine the toes. And if the skin color is gray-blue, that may indicate a circulatory disorder or any injury due to cold. After top to toe, ask for history and external clues. For every incident, gather as much information as possible from the casualty and any eyewitness. However, be wary for such information. Though useful, most of the time may also be misleading, inaccurate, or untrue. The following are some important aspects of history taking where we use sample code to make sure that we remember everything and we ask the important and appropriate questions. Where S stands for signs and symptoms, A stands for allergy, M stands for medical condition or medication, P stands for pertinent past, L stands for last oral intake, and E stands for event surrounding the incident. And now I will explain more. Sign is what you can see, like swelling, bleeding, discoloration, deformity, and compare the injured body part with the uninjured side. Also, you can see medical warning bracelet or necklace and so on. So sign is what you can see. And the symptom is what the patient describes. Ask much details as possible, but keep them short and simple while listening carefully. For example, you can ask him or her to describe the pain, like is it sharp pain or a dull pain, while making eye contact always when talking to your casualty, and so on. For allergy, is the casualty hypersensitive to any drug, food, or other environmental allergies? For M, which is medical condition or medication, is the casualty on any medication currently, or is the casualty on prescription or not? For pertinent past, is there any past medical or surgical intervention? Is there any history of similar illness or injury? For the last oral intake, what type of food taken, if any, and at what time? For events, what happened just before the incident? And always remember to compare the injured. For external clues, some casualty who have a long-standing illness may have some form of medical identification. This could be a tag, a warning bracelet, or an inhaler, or a card. Asthmatics may have inhaler, diabetics may have sugar lump or sweet. Those with angina, which is a heart condition, may have tablets. Look for these clues and use them to help you reach a diagnosis. But bear in mind that a casualty may be suffering from different conditions as well. For instance, a casualty who usually has a heart condition may be unconscious due to stroke. The external clue must therefore be correlated with evident signs and symptoms so as to reach to a logical conclusion. At the end of your secondary survey, you should come up with a good and clear report to give to the medical personnel who will take over the care of the casualty. This will hasten diagnosis and treatment of the casualty, especially if the casualty is or becoming unconscious. It is therefore important to document all the findings from your assessment. Now we learn how to put an adult in recovery position, or what we call semi-prone. An unconscious casualty who is breathing but has no other life-threatening condition should be placed in recovery position. And what is this recovery position? Recovery position is placing an unconscious person onto their side in order to protect the airway, which also ensure that any vomit or fluid won't cause them to choke. In this position, you keep their airway open and clear, and also helps ensure that the person will not choke on any fluid or vomit while unconscious. The vomit will drain away without interfering with their breathing. In recovery position, the person is positioned to lie on their side if you do not suspect spinal injury. The head is also gently tilted back and lifted through the chin to ensure that there is nothing blocking the airway. The person's condition is then continuously monitored until help gets to the scene. If you find someone collapsed, you should first perform primary survey, and if it shows that they are unresponsive but breathing, put them in the recovery position as follows. Kneel by the casualty and straighten the legs. If they are wearing glasses or have any bulky items in their pocket, remove them as you get there. Place the arm that is nearest to you at a right angle to their body, with the elbow bent and their palm facing upwards. Bring their other arm across their chest and place the back of their hand against their cheek nearest to you and hold it there with your hand. With your other hand, the one on the lower extremity side, pull their fanny up so that their foot is flat on the floor. Keep the back of the casualty's hand pressed against their chest. Pull the far leg to roll the casualty towards you on their side. You can then adjust the top leg so that it is bent at a right angle. Gently tilt the casualty's head back and lift their chin to make sure their airway stays open. You can adjust the hand under their cheek as you do this. Call for an ambulance if it hasn't already been done. Monitor their level of response while waiting for help to arrive or an ambulance to arrive. If they remain in the recovery position for 30 minutes, roll them into a recovery position on the other side. Please note, if you suspect spinal injury, use jaw thrust technique. Place your hand on both sides of their face. With your fingertip, gently lift the jaw to open the airway. Take care not to tilt the casualty's neck. Grasp the angle of the lowest jaw and lift with both hands on each side, moving the jaw forward. If the casualty's lips are closed, try open the lower lip using your thumbs. And also note to turn expectant mother on their left side so to increase blood flow to the heart and to the baby when placing into recovery position. This will prevent compression of the inferior vena cava by the uterus, which could be fatal for both the mother and the child. For babies, this is what we do. For baby less than a year old, a modified recovery position must be adopted. Cuddle the infant in your arms with the head tilted downwards to prevent the baby from choking on their tongue or inhaling vomit. Monitor them and record vital signs. Yep, check for level of response, check for pulse, monitor breathing until medical help arrive or until you get to the hospital. Thank you.